This DVD has been designed to guide you through your rehabilitation after having your anterior cruciate ligament reconstructed. Ensure you follow all the instructions and only progress onto the next stage of exercises if your swelling and pain is controlled. For the first 2 to 3 weeks, you should rest as much as possible. This is to allow the swelling to settle and the incision sites to heal. Bend and straighten your knee as much as you can, 10 to 20 times every 2 hours. Rehabilitation takes 6 to 12 months and requires a lot of exercises to get a good result. Tighten your buttock muscles. Hold 10 seconds. Repeat 10 times every 2 hours. Tighten your thigh muscles. Hold 10 seconds. Repeat 10 times every 2 hours. Stand facing a wall. Operated leg behind. Stretch the calf area. Hold for 30 seconds and repeat twice. You should be standing. Step operated leg forwards and lean to stretch the hamstrings. Hold for 30 seconds and repeat twice. Sit with your knee extended and foot on a stool. Relax and straighten the knee for 5 minutes. Pull your heel onto the ground and tighten the hamstring using 50% effort. Hold for 5 seconds. Do this 10 times. Do these exercises 3 to 5 times a day. Lying on your side, lift and lower your leg. Repeat 10 to 15 times. Standing, lift up onto your toes and lower. Repeat 10 to 15 times. From the sitting position, stand up. Repeat 10 to 15 times. In week 5, begin using one leg. With all of the exercises, if you have any pain or increase in swelling, then stop and then reduce your exercise level. Start at week 5 post-operation. Lift your heel upwards towards your bottom. Repeat 10 to 15 times. Do these exercises 3 times a day. Squats are usually done with both legs and then later progressed to the operated leg 8 weeks post-operation. Stand with your feet hip distance apart. Bend your knees to 90 degrees maximum. Repeat 10 to 15 times. Only start when the swelling is controlled. You have full extension and normal gait. With all of the exercises, if you have any pain or increase in swelling, then stop and then reduce your exercise level. Step-ups. The operated leg stays on the step and the other is raised and lowered. All the effort is done by the operated leg. Repeat 10 to 15 times. Lying on your front, curl your foot towards your bottom. Repeat 10 to 15 times. Lying on your back, lift pelvis upwards. Hold for 5 seconds and lower. Repeat 10 to 15 times. (6 weeks to 12 months post-operation). Do these exercises 3 times a day. You can start these exercises once 70% quads and ham strength has returned. Step one foot in front of the other and lunge forwards. Return to start position and repeat on the opposite side. Repeat this exercise 10 to 15 times. Standing on the operated leg, softly hop on one leg. Repeat 10 times. Start doing this exercise from about 4 months after your operation. Jog about 10 metres and repeat for 5 to 10 minutes. Start this at 5 months post-operation and repeat for 2 to 5 minutes. Rehabilitation takes 6 to 12 months and requires a lot of exercises to get a good result. Return to work or sport-specific work 6 to 12 months post-operation and when no pain or swelling is felt with impact exercises. If you go back too soon, you are at serious risk of further injury. Be careful at the 6 to 12 weeks post-operative period. This is when the graft is at its weakest. Therefore, do not try to run, jump, or twist the knee. And be careful on stairs and curbs at this time. After your operation, regularly apply ice to your knee to help the swelling and pain in the knee for 20 minutes at a time every 2 hours, as well as regularly take your painkillers as prescribed.